So the name is ode to Stephanie Leonard, who is also on the call and co-leads the group with me, along with Louisa Smith from Northeastern. So Stephanie and I are at Stanford, and Louisa is at Northeastern, and we are leading the Perinatal and Reproductive Health group. So we're a new group. We had our first official meeting only in December, and we've had one in January, February, and our next is actually March 15th. The purpose of our group, we exist to develop tools and standards for perinatal and reproductive health research, to foster collaborative studies within the OHDSI network, and of course to advance research in the field. I think I'd been aware for a while that there was pockets of OHDSI researchers who were doing really related things, and with Stephanie, we got excited about the idea of making this a formal group where we could bring those people together. And so we have 2 OKRs for 2023. The first is to improve capture and representation of pregnancy and reproductive health data in the OMOP CDM. So our first sub-activity there is to complete a landscape assessment of how different institutions, that is OHDSI sites, represent and organize pregnancy and reproductive health data writ large. That's sort of a big activity, but we're focusing first on specifically pregnancy and delivery data. And to produce a report that summarizes our group's consensus on what we think are best practices for structuring these data and doing perinatal and reproductive health research using multi-site data in the OMOP CDM. And then our second high-level OKR is to create a network of partners who are interested in doing perinatal and reproductive health research in OHDSI. And to that end, we aim in 2023 to conduct 10 group meetings that include representatives from at least 10 institutions on topics relevant to our first 2 OKRs. So far, we've had between 20 and 30 people on our calls, which has been wonderful. And to pilot an initial research project with at least 5 institutions. And our proposal for that project right now, that network study, is to look at antihypertensive medication usage in pregnancy. And this is very much related to research that Stephanie Leonard is doing. Our next call is March 15. It will be on parent-child linkage algorithms, and we'll have Jamie Weaver and others coming and presenting on projects related to that, and a review that has been done on that space. So if you're interested in joining this work group, come and email us or look at the page that Craig will add our info to. Thank you.